Welcome to another edition of the Invisible Wheelchair Podcast. I'm Donald Grodoff, family coach with FamilyOCD.com and FocusedHealthyFamily.com. In the Invisible Wheelchair Podcast series, I delve into the hidden characteristics of OCD, anxiety, and anxiety disorders. The things that most people don't see, that are behind closed doors and shut within the mind about anxiety. My goal with these podcasts is to bring about awareness of Obsessive Compulsive Disorder, or OCD. Understand that I am not a doctor, therapist, or counselor, and the content, information, resources, and ideas that are talked about and brought up here in these podcasts are things that I have used, discovered, or have been recommended to me, and I always recommend to seek additional professional help in finding solutions for yourself. Thank you for listening and enjoy the podcast. This podcast was recorded on July 14, 2017. This is podcast number 13, OCD and the Flood. Recently I saw a movie called Everything, Everything. I don't know if you've seen it or not, but the basis of the movie is about a girl that has contracted a disease called SCID, or Severe Combined Immune Deficiency, SCID, SCID. And it's a deficiency in the immune system that allows the person to be more extremely accessible to disease, viruses, etc. And in this particular movie, the girl is living in her house and has never left her house for her entire life. And she stays in this house because if she goes outside, there's a chance that she could get very sick and die. It can be a fatal syndrome or a fatal disease. Of course, now the movie was a poor portrayal of this disease from what I've read, but the whole thing about that extreme sense of keeping them away from the outside world or from what is going to trigger their disease falls in line with one of the two kind of extremes with OCD. And I'm going to talk about one extreme called flooding, and I'll talk about that in a minute. But in the sense of what the movie, and I'm not going to tell you the ending of the movie, even though it has a rather unusual twist to it. The one extreme of OCD is to avoid or to encapsulate the person from what triggers them. So in other words, let's take for example germophobia, which is a little different than OCD, but it's a good example base. Let's say with a person with germophobia, we have the extreme of putting them in a bubble so they're not exposed to the germs and all that most trigger their anxiety. Or giving them a hazmat suit that they wear all the time so they can go roundabouts in the world without worrying about it. And that extreme only feeds the situation, only feeds the germophobia. As in OCD, for instance, it's say for instance in the example of my own daughter, what happened with her situation was a particular item. It was actually cigarettes and smoking. And in our case, nobody in our family smoked. Even in my extended family, there was no smokers. So we don't know where that came from, and that's not the point here. The point would be that I would, as um, a caretaker of my daughter, would try to eliminate all cigarettes from the world, or eliminate her exposure to a cigarette butt on the ground by removing them all. Well, that doesn't really help. It would help her because it would give her comfort that she didn't have to worry about that. But I can't do that. I can't eliminate all those people, even though I think they're ridiculous myself in smoking. I can't eliminate that. She's going to run into that in her life. And if I try to make her avoid or stay in the house or whatever, then I'm really just feeding the OCD. Because what it tells her through OCD is that then you're right that cigarettes are really terrible and could kill you. Now, that one of the toughest points for us as parents was, we understand that cigarettes are bad for us. So, but the point with her was not that cigarettes are good for you or bad for you, but that she shouldn't be fearful of them. If it's, she's not smoking, it's the other person smoking. It's them, their problem, not hers. And to be to be fearful of them when you're not involved with them is not a good fear. So it was a tough balance for us, because how do you tell your daughter not to fear something or not to believe something is bad when it is really bad for you? But again, it's so anyway. So the principle here is talking about going to that extreme of trying to wipe out any cigarettes involved around the people she sees and all that would be very difficult to do and not realistic, and so it would be feeding OCD. Now, the other extreme, at least the way I see it, again, remember, this is my opinion from my experience, from the talk and the studying that I've done. There is a process out there called flooding. And you may have heard of it. You may have had people suggest that to you as far as a therapy or a treatment for OCD. And what I want to do is expose you to the idea of flooding so that you know what it's about. And what flooding is, now with OCD, and we're going to talk about ERP. I'm going to do a podcast on ERP, exposure response prevention therapy, which is one of the best methods of using it. In that, you're doing a slow, methodical process of exposing them to the triggers, like with my daughter, exposing them to a cigarette butt on the ground, exposing them to their triggers on a very methodical, slow process that gets them to become desensitized to that trigger. But in flooding, what they're doing in the ERP, in the slow process, what you're doing is you're getting a hierarchy of different triggers. What's your worst, what's not as bad, the prioritization of your triggers. And with ERP, you can either work on the least of it to get ease into it, or you can start out with the toughest one. Most people like to start out with the easiest one, or the least anxiety-driven trigger that you have first, and show accomplishment by getting past that one, which is a lot faster, a lot easier than the toughest one. But some people do start out at the toughest one, but the principle of it is in ERP, exposure response prevention, it is a slow, methodical process of being desensitized to that trigger. Flooding is really just pretty much kind of almost the opposite. It's going towards the highest of that hierarchy, the most anxiety-driven trigger, and just bombarding you with it or flooding you with it all at one time and letting you sit through it. So in other words, uh, in my daughter's case, with cigarette butts, it would be putting her in a room filled with them and letting her sit through it for 10, 15 minutes, letting her go through the anxiety of it and trying to come out the other side. And they do note, I was looking, one of the places I looked was Psych Central on the web for some information about, to get a little bit more familiar. I was familiar with it. I had looked into it and studied it back in the years when we were going through it with my daughter, thinking we should try that. It might be good. Um, and so I wanted to go back up and refresh myself, and I looked at Psych Central. And one of the disclaimers, let me read one of the statements they make. This technique should not be attempted until the client has successfully learned relaxation skills and can demonstrate their use to the therapist. Exposing a patient to either of these techniques, they're talking about flooding or I can't remember the other one they were talking about, but they were talking about two different ones, but flooding was one of them. Exposing a patient to either of these techniques without increased coping skills can result in relapse and a possible harm to the client. And they state relaxation techniques such as imagery, breathing skills, and muscle relaxation. And I think that statement's important, that if for some reason you decide to use flooding, that you do need some techniques in learning to cope with the high anxiety that was going to come about. And EFT, which is one of the things I practice, would be another good technique for being on. That's what I used with my daughter, and I used again with my youngest, going through this OCD stuff. But in this case, flooding, and it makes a stimulation that there are, not everybody can do this. And I would make my own opinion and my own experience say that it really, nobody should go through it, because it is just too extreme to really work properly. And I know this from talking with others, from the research I've done, and even talking to some therapists that I've talked with and worked with, even though our own therapists didn't recommend it at all. It can be put to analogy of swimming, going in the pool. Now, you can dive into the deep end, just dive straight in and hit that cold water and get the shock of the water, and eventually you will acclimate to the temperature of the water and be fine. But that initial shock can be very traumatic to the body, versus putting your toe in first, and then your foot, and then your leg, and then your waist, and slowly but surely getting to the swimming point. There's an analogy there. And so the flooding can be such a shock, it can be such a traumatic shock that it actually backfires. And I'm going to tell you just a little story about my own daughter and how I got a taste of this, because we weren't intentionally going for flooding, but there was a situation that happened that shows me that flooding can be dangerous, that can backfire. Because here's what happened in my daughter's case. We started on the ERP, the exposure response prevention. And like I said, I'm going to go through that in another podcast, because that to me is one of the best. And I don't want you to think that anything differently about ERP because of this story. But we'll go through it. But it's a methodical, slow process of exposing someone to their triggers. And we were working with that with my daughter. We were doing what I call homework, where she was doing these steps in ERP. And we had a day that we had been working on. One of the issues with my daughter was uh, used items, and one of them was library books was one of her kind of hierarchy triggers, her really anxiety triggers was library books. So we were working on exposing her to that trigger. And on this particular day, we were having a really good homework session, as like I used to call it, her homework she'd have to do in these steps. And we were stepping along with it, and we were exposing her slowly but surely to this. But we were doing it so she was getting excited and happy about, you know, with exposure response prevention. Like I say, I'll go over this more, but you take, I mean, very slow steps, very bold, broad steps, I should say. You might take a picture of the book and look at the picture first, etc. And we were stepping through these and making progress very quickly over the week or so that we had been working on this particular trigger. And we got to one day where she was just doing so well, and I was kind of coaching her along, where I was saying, well, let's make a little more advance towards it, and a little more advance toward it. And she was doing it very happily. And she got to a point where she was actually willing to touch the book. And I was excited. I was texting the therapist going, is this good? Should we be doing this? She's excited. And the therapist was kind of there, yeah, well, maybe you should try it. Well, she touched the book and then actually grabbed the book. And we both were elated. We jumped up, we were dancing, I was actually crying a little bit because it was a huge step for her to do that. And everything seemed to be fine with it. Everything seemed to be good. We talked about it afterwards. The rest of the day, she was really kind of proud of herself that had taken this step. But the next day, and this is one thing I found with OCD, OCD likes to come back with a revenge. And it did. It hit hard. And my daughter ended up not being able to touch anything and being stuck on the couch for over 8 months. It literally threw everything we had been working on the exposure stuff for months. I would say probably 6 months. And everything was going so well with it until that day. Everything backfired and went backwards. Reversed everything we did over the last 6 months and actually went farther than that. Literally, she stopped touching anything or anybody, and we couldn't touch her. She lived on the couch and had a special technique, a special blanket, all of that kind of stuff. And it started this whole process of this compensation we had to do, this backwards motion we had to do. So to me, that experience and what we suffered after, because then it was like starting all over again. And it took a lot of pain. That threw us back really years worth of time because of that. So that gave me a taste of what flooding would be like, because we went full bore on that day and caused her to completely reverse, and it backfired. And I've found that in many cases, that same kind of scenario was happening because of flooding. People that were in residential treatments went through some of that flooding and really felt like it had backfired. So I wanted to bring this to attention because I know we were exposed to the idea of flooding at the time when we were looking at what do we do. And we were looking at ERP, and we were looking at the idea of flooding. We picked our ERP without really totally knowing any kind of experience with flooding. So I'm glad that we did the ERP first to get us an idea of what works. And then we had that experience, which really helped me to decide ever against doing flooding. So I'm not here to tell you not to do it or to do it, but to understand the consequences of it and what it is involving so that you can make a clear decision. It doesn't mean that all people, apparently there are people out there that have gone through it and it's worked. But to know the repercussions of it, to know what you might need to do along with it, like these relaxation methods, the EFT, the alpha stem, different things you can use for them to help them to go through, because it is going to bring up a tremendous amount of anxiety. So an ERP does too, but it's done in a way that it is handled so much better. And again, look forward to an upcoming podcast on ERP, exposure response prevention therapy. And I thank you for this, and I hope that it has helped. This concludes this podcast. Please remember to leave comments from me, because that really helps me to understand what you're looking for and helps give me fodder for the next possible podcast. Also, I'd love to hear your invisible wheelchair story if you're willing to share it. If you are, feel free to go to invisiblewheelchair.com and click on Tell Your Story. Now, if you've heard these things and you feel like you need further assistance or some help in what you're going through, and you want to spend some time with me working through those issues, then feel free to book a session at focusedhealthyfamily.com or familyocd.com, or simply call me at 704-562-1630. Finally, don't forget there is a tap-in recording following this podcast you may want to take advantage of. I hope you've enjoyed this podcast and will join me for the next one. Remember, keep tapping, talking, and transcending your life into new heights. Thank you, and have a great day.